Hola, and thanks for having me here today to speak to you at the conference. I hope that you have a very good workshop that can lead to an excellent national plan for Colombia. So, let me just very briefly start by telling you what the foundation is and what we believe in. The foundation, the One Sight Laxatica Foundation, believes that good vision is a basic human right. We are directed by the fact that uncorrected poor vision affects 2.7 billion people around the world and is a major driver of poverty. The foundation's main pillar is creating sustainable access, main pillars, funding subsidized and free services, advancing advocacy and awareness, and innovating for affordable solutions. And by engaging in activities under these pillars, we hope to eliminate uncorrected poor vision in a generation in partnership with governments and other civil society organizations. So when we look at the global context on blindness and vision impairment, we see that uncorrected refractive error is the second leading cause of blindness after cataracts, and it's the main leading cause of moderate to severe vision impairment. This immediately places uncorrected refractive error as a major public health challenge in our world. If we use a more relaxed cutoff point like the WHO uses around 618, we find that there are about 1 billion people that have poor vision in the world that can be prevented or as yet to be addressed. Out of that, majority, 900 and some odd million of that, is uncorrected refractive error, either distant or presbyopia for near. So let's look at the situation in terms of the services. What are the unmet needs? And if we look at them in terms of WHO regions, we can see that Europe, Australia, and the more developed countries have a better provision of spectacles or services to the people. If we look at the Americas, it's 21%. And in fact, it's a pity that this data was merged because we know that the US access is much higher than the North American access is much higher than the South American access. So we've got a major challenge still in South America, in Latin America, in terms of access to eye exams and spectacles. So the unmet need in the South or in the developing world is much greater and is a major challenge to us. Many of you may have been exposed to the myopia burden. We know that the lifestyle changes is impacting significantly on this, particularly near work, as technology becomes more popular. And as a result of that, by 2050, half of the world's population will be short. And the bigger problem is that 20% of this 5 billion people will be short-sighted, will be at risk of having ocular disease that can cause permanent vision impairment and blindness, and placing great strain on health systems across the world. So given that context, there has been much developments that have occurred, positive developments that have highlighted uncorrected refractive error as a leading public health issue. There's been the World reports, the Lancet report, the ESSELO report that came out, and all of these have identified the fact that uncorrected refractive error is a major issue in our world. The World Health Assembly passed a resolution to increase effective refractive error effective coverage of cataract surgery by 2030 by 30%. Concurrently, the same resolution carried a request or an objective of a 40% increase in effective refractive error coverage by 2030. And this is a huge development. Many of you who have been around in the sector for a long time will know that refractive error was very much on the sidelines of even the WHO. But it's now one of the main agendas that's being driven by the World Health Organization. The UN General Assembly adopts a resolution on vision for the first time, and that talks about global efforts to reach by 2030 at least 1.1 billion people who have a vision impairment and currently do not have access to eye care services that they need. This is a significant development because the UN generally has addressed many other health issues, but not the question of uncorrected refractive error, which is the major part of that 1.1 billion. This WHO SPECS 2030 initiative has been launched, and I know that you're going to have more discussions about this, so I'm not going to talk too much about it, but it's a major achievement because now there's a major program that's been defined and driven from the WHO. And in the past, we have had mainly guidelines coming from the WHO. Now an effective strategy is being driven. And across the globe, there's excitement about this. There are various governments in Africa, where I'm based. We have at least about 5 or 6 countries that have already had meetings, and they're starting to put together national plans around WHO SPECS. So it's brought a lot of energy into the sector, but it will bring a lot of support in terms of guidelines, funding, and various other aspects. And its aim is to achieve the targets of the World Health Assembly. SPECS has various pillars, which S stands for spectacle, P for personnel, E for education, C for cost, and S for surveillance. So the major issue that I need to talk to you about today is how do we respond, or how do we scale up services in our world? The reality is that the biggest mistake we can make if we believe that one sector can do this. As an optometrist, I'm in forums where the private sector will say, we can sort this out. But there's no evidence of that. It's never been done. We've had governments that have claimed and have set out actually well-meaning governments to solve the URE problem, but their budgets often fall short of the demand. So we need a multi-pronged approach, one that includes national government leadership, and that's what you are gathering today for. Develop private sector, social enterprises, and other entities to contribute. We need philanthropy. The poorest of the poor cannot afford often services. And if government budgets are not enough, we need philanthropy to be mobilized. And often, we have to ensure that these budgets are driven through public health programs, because that's where the poorest of the poor go. We need to look at the technology opportunity and how technology can be mobilized. We know that in areas where there have been programs established, we need to focus on demand generation, because without awareness and advocacy with key community leaders, etc., we often do not have the uptake of services like we would like to have. And then the most important thing is the human resource development. And we know that many regions are underserved with eye care professionals. If we look at ophthalmology, we'll notice that Latin America is somewhere around the 60 to 70 on the scale. And this tells you, this gives you an idea, and the best way to understand this is look at the developed world. They are closer to the developed world is closer to 100 on the scale in terms of ophthalmologists and optometrists per million population. We look at optometrists in Latin America. You can see Central Latin America, Tropical Latin America here. It falls closer to 100 per million population, or even lesser than that. So we are in a critical situation when we look at the number of optometrists and ophthalmologists in the developing world. So how do we respond? Then our strategies have to be realistic, because it will take us generations to develop the number of optometrists and ophthalmologists that are needed. So we need to look at various aspects. The first thing is to creating sustainable access points. Okay? And in this respect, we know in many parts of the world, vision centers have been set up by nonprofits and social enterprises. We need public sector eye clinics. We need social enterprises where, like in our case, we have, as one site, we have trained close to 30,000 entrepreneurs across the globe to own their own optical shops in rural communities. Private sector, we have quite established private sector often in some of the countries, but the reality is that they are not being mobilized to serve at least the working poor. And we need to look at that. Can the private sector, for example, have affordable packages so that government has less of a burden to address and can put the limited resources towards the poorest of the poor? We've seen how technology has been used in previous efforts and challenges. We were in meetings where people told us they have the solution to the world. We had adjustable spectacles. We had the iNetra. We had various screening tools that were developed. But the reality is that most of these have not taken off because because they are not able to work within a public health system often, and just they get mobilized from a screening perspective. And many people have not tried to integrate these into the public health system. But there's a game changer. For example, telerefraction has now become a major priority. And here you have an optometrist at a central hospital overseeing a technician in a rural clinic or rural hospital. Now, many of you will say, but that cannot happen within government, because many people are often skeptical about governments implementing it. But in Kenya, for example, we have an optometrist employed by the Kenya Society for the Blind, which is part of government. And they then have centers in rural centers where technicians have been trained to help the optometrist to change the lenses, take the measurements, etc. And at the end of the day, the optometrist would be the person in this below the third picture on the bottom end. Is the optometrist is observing and then signs off and basically prescribes. And we are now seeing that services are being taken to areas where optometrists, for example, we know will never ever go and serve. So there's opportunities to look at services very different. We as one side provide the technology for that, but the reality is this is a public sector program that is being implemented and creating access. Awareness is huge. We need to make sure that at multiple levels, both at a national level, and governments have particularly access to national broadcasters and other agencies, we need to mobilize around awareness in terms of uncorrected refractive error, because there are some biases. People don't want to wear their children to wear glasses. We should be cognizant in Latin America about the myopia issue, and we should be, for example, having public sector announcements that ensure that people are ensuring that their children spend more time outdoors. And we know if they spend 3 to 4 hours outdoors, that's a very safe number every day that will protect many children from being myopic. On a broader scale, we have to understand that this global challenge is not going to be solved by governments alone or the private sector alone or non-profits alone. We have to come together, all of us, and make this contribution. I often use this term partner or perish. Those who develop and invest in programs without partnerships are going to perish. And this is very important, both at a local level, global level. It makes a big difference. There are some positive things. The Clear Vision Coalition has been set up, which is focusing on uncorrected refractive error. And this coalition now has many nonprofits that are working with governments and intend to expand across the globe. We know our children are the future. We know about the myopia boom. We need to drive children's vision. And in this respect, a global children's, one school at a time, a global children's vision program has been launched. And this program is looking at how it can support governments in partnership with nonprofits, private sector, and other agencies to drive access for our children. Because often children do not, for child eye health, we need to mobilize free services because children don't control the purse strings, and it's important to have the intervention. So it's an opportunity for you in Colombia and as the rest of the world that this change is occurring. There's this focus. And it's the time has come for us to think and act differently. If we don't and do the same things that we were doing 10, 20 years ago to address uncorrected refractive error, I think history is going to judge us very harshly. I wish you all the best in your deliberations and hope that Colombia can be a leader, not just in Latin America, but across the globe in driving access to refractive services. Thank you.